I'm laying on a bed with my newborn daughter on my chest, skin to skin. She is finally outside of me after 42 hours. Sorry, weeks. Big difference. She is perfect, and all of the effort exerted over the last 15 plus hours has dissipated miraculously, almost instantaneously. Endorphins are flooding through my veins. I have never felt such relief, such joy, or such pride and amazement. I've never felt so alive. Music that I carefully curated for this day, for this moment, is playing softly in the background. I can hear familiar voices moving around us, tidying up, everyone continuing with their duties, while periodically checking in to comment on how well we are both doing. Me and my girl. I didn't think I was carrying a girl in all of that time, and I am so grateful that she is one. This is Grace. Then, in an instant, the energy in the room turns. Something isn't going as it should be. My baby is in my arms, but I'm not finished giving birth. The period from just after a baby is born until just after the placenta is expelled is called the third stage of labor. And it usually occurs within 15 to 20 minutes of the birth. Ample time has passed, and my placenta still isn't budging. I'm nursing Grace when they gather around, massaging my stomach to help the uterus contract, gently tugging at my umbilical cord. Finally, the midwife calls for backup. My baby is taken from my arms, and I'm lying there, feeling vulnerable and confused. The doctor is now standing over me. I can still feel the pain of the extraction that followed. I can still see the blood. By the end of it, I had hemorrhaged about 800 milliliters of blood. That's almost 2 pints. But then it's over. I'm catheterized and given antibiotics. I'm home again in less than 24 hours. I'm lucky. There were a lot of things I didn't know about pregnancy and childbirth before I went through it myself. I didn't know how reassuring those prenatal checkups would be at every stage of the pregnancy. I saw my midwives regularly up to the delivery and met the backing physician on my tour of the hospital birthing center. I had a support system in place. I was lucky. I knew how I wanted my labor and delivery to go, and I had a plan to ensure that outcome. I wanted to have an unmedicated birth, and I knew that working with a midwife was the surest way to have one. I wanted to be fully present for this experience. I wanted to go into motherhood with my eyes wide open. Mission accomplished. My eyes were now open. I know a lot about pregnancy and childbirth now. After my own brush with one of the leading causes of preventable maternal death, I was compelled to do everything that I could to help and prepare and support other women. As I was becoming more confident and familiar with the practice of mothering my newborn, I was also becoming more educated about the state of maternity care around the world. I learned that hundreds of thousands of girls and women were dying from pregnancy-related complications every year. The majority because they didn't have access to the appropriate care needed to save them. What moved me to action was learning that nearly all of these deaths are preventable. Over time, I would travel to some of the places where becoming a mother is reported to be the most dangerous: Sub-Saharan Africa, South Asia, Latin America, the Caribbean. And as I traveled, I saw the world through new eyes. I saw the world through a mother's eyes. Sorry. In Peru, I met Mama Asunta and her family outside of their home in a remote community in the highlands. With her husband's encouragement, she delivered their 7th child in a new clinic nearby. Mama had been reluctant to do so for many reasons. She had delivered all of the others at home, including her twins, and there had been no problems. She also had a lot of work to do, and she couldn't afford to leave the other children behind to go to a clinic. When I visited the clinic later that day, I looked at it through Mama Asunta's eyes. I found it to be clean and welcoming. The staff included a Quechua-speaking midwife, which was comforting. They had replaced white hospital bedding with more inviting floral prints. There was a room set up for women to deliver vertically, with a birthing stool and other props. As I toured the clinic, I asked myself, would I want to give birth here? Yes. These were the very same comforts that I was looking for when I was choosing where to deliver. In one room, there were murals painted on the walls to illustrate warning signs in pregnancy and postpartum, so that the women and their families would know what to look for and when to seek care. There was a 24-hour radio set up to link the clinic to the referral hospital a few hours away for emergency transport. Everything I saw made so much sense to me through a mother's eyes. One of the best ways to prevent maternal deaths is to make sure women are healthy before they become pregnant, and that they have the ability to plan and space their pregnancies. Women with consistent access to a healthcare provider throughout their lifetime are more likely to identify complications early on, which maximizes the chances of a healthy pregnancy and birth. Safe pregnancies do not begin or end in the delivery room. What happens before and after counts too. A continuum of care is essential if we want to improve birth outcomes for mothers and babies. When I attended the first TEDWomen in DC in 2010, the US had a higher maternal mortality ratio than 40 other countries. It was tied with Saudi Arabia for 41st place. Now we are 46th. 46th. How is this even possible? After decades, maternal mortality was finally beginning to decline around the world. But while other countries were improving maternal health and reducing death rates, they are steadily on the rise in the United States. America spends more per capita on healthcare than any other developed nation, but we don't have the birth outcomes to show for it. Not even close. We have the highest rate of maternal deaths in the developed world, and are the only industrialized country with the rising maternal mortality ratio. We think of ourselves as innovators and leaders in a lot of things in this country. But what the statistics behind the stories are telling us is this, or the stories behind the statistics, is telling us this. We could and should be doing better, America. Having a baby is one of the most costly events an American family is likely to encounter. The average cost for pregnancy and newborn care back in 2010 was $20,000 for a vaginal delivery and $30,000 for a C-section. And those costs have been increasing ever since. For those who live far from cities, there's a shocking lack of providers nationwide. Nearly half of all the counties in the United States do not have an obstetrician providing maternity care. Midwives could fill the maternity care provider shortage for low-risk, healthy pregnancies, but in 2014, less than 10% of births in the United States were attended by midwives. In fact, nearly 13% of women delivering in Florida did not have adequate prenatal care. And in Louisiana, about 1 in 5 Black or Hispanic women have not seen a doctor in the last year due to cost. Do you know that in 2017, the United States is the only developed nation that does not have paid family leave mandate? And only 5 states, California, New York, New Jersey, Rhode Island, Washington, and the District of Columbia have enacted paid leave policies to date. We have the worst maternal health in the developed world, and it isn't going to improve without our help. So what can we do to fix maternity care in this country or in others where healthcare systems are broken? As we start to build and rebuild our healthcare systems, let's please remember what you learned here today and think about how we can make the system more welcoming and inclusive for our mothers. A woman who lives in a rural part of a state like Montana might have to travel up to 5 hours round trip to get prenatal care or for a facility delivery. For women with chronic health conditions or pregnancy complications, a prohibitive distance from specialists means they go without the care that they need. For women of color, distance is not the only barrier. In New York City, a Black woman is 12 times as likely to die as a Caucasian one. The inequitable distribution of resources in neighborhoods made up primarily of people of color enforces drastic disparities in pregnancy outcomes. Some American women aren't even seeing a healthcare provider at all. Luck should never be the sole determinant of childbirth or motherhood. All women need access to prenatal care and childbirth information. Pregnant women need to be in the care of a compassionate and skilled healthcare provider at the time of delivery. The minute that the baby is delivered and the postpartum care begins. And don't forget, motherhood will last the rest of your life. Let's just keep our eyes open because every mother counts. Thank you. Thank you.